Please take your seats and we'll get started. Sexual assault is any sexual act performed by one person on another person without that person's consent. The incidence of sexual assault is not known. Published statistics only encompass reported sexual assault. In some cases, the victim is unwilling to notify authorities or seek medical attention for fear of personal humiliation. In other cases, the victim is unwilling to notify authorities because she fears retribution. In some cases, the victim, particularly in cases of incest or close personal relationships, doesn't wish to disturb the family or friendship unit, dysfunctional though it may be. In some cases, the victim is not aware that the crime occurred, for example when illegal drugs or alcohol are involved. Sexual assault is usually not a crime of sexual gratification, but rather expresses power, anger, hostility, or aggression. Although the stereotypical perpetrator of sexual assault is a stranger, in real life the rapist is often known to the victim. This situation is known as acquaintance rape, or when applicable, date rape. Sexual assault is an act of violence with medical, mental, and legal issues which should be addressed. I'm going to describe a standard medical approach to sexual assault when resources are available and clinical circumstances allow. Let's first consider a basic strategy of management. First, evaluate the patient for serious injuries, such as fractures or hemorrhage, which might require immediate treatment. Obtain a brief history explaining to the patient what will occur next. Obtain the patient's consent. Gather all your necessary materials and notify legal and administrative authorities. Examine the patient, obtaining various specimens. Offer treatment for STDs and pregnancy. Arrange for follow-up care. Now for some specifics. Serious injuries always come first. If the patient has serious injuries, take care of the injuries before worrying about collecting legal evidence. Patient care always takes priority. Notify legal and administrative authorities. Early in this process, legal and administrative authorities need to be notified that a sexual assault has been reported and medical care is being provided. Depending on your location, this might include local, county, state, or federal law enforcement agencies. Notify social services. In some settings, a sexual assault counseling service is functioning and can be contacted. In other settings, social workers or other support personnel are used for this purpose. Sometimes a chaplain serves the role of a social service provider and should be notified of this occurrence. Chaperones. Customs vary regarding the use of a chaperone in general OBGYN practice, but they don't vary at all in the context of a sexual assault victim. It's important to have a medical chaperone, preferably someone from the nursing community, who can be a witness both to the history taking and the physical exam. This person can also provide valuable comforting and support to the victim. Gather your supplies before starting your exam. Before you actually examine the patient and begin to collect your exam specimens, it's best to gather all the materials you will need first. This saves you time and spares the patient the unpleasantness of a prolonged examination. It also helps you avoid forgetting something. If you think you have completed your exam but you still have some supplies left, you probably forgot about something. In many areas, sexual assault investigation kits are prepared in advance, containing everything needed for this exam. If a prepackaged kit is not available, you may wish to consider making your own prior to the need for it arising. All specimens should be properly labeled and maintained by a precise chain of custody. Labels. Every specimen taken from the patient must be properly labeled. The labels should include the patient's name, social security number or other unique identifier, the date, the time, the identity of the specimen, for example, fingernail scrapings, the location, for example, the right hand, and the examiner's initials. It's helpful to make up your labels before you examine the patient. In addition to labels for all of the specimens, you will need to label lab requisitions, your medical report, and the consent forms. You'll need at least 25 labels, not counting any labels used on laboratory requisitions. Consent. Consent should be obtained from the patient to examine her and provide medical treatment, collect evidence, take photographs if indicated, and to release medical reports and evidence to legal authorities. History. There may be a balance between obtaining enough information to effectively treat the patient and asking questions that make the patient uncomfortable. While some sexual assault victims are anxious to discuss exactly what happened to them, many more of them are silent and withdrawn, exhausted from their experience. Ask the patient what happened. Ideally, she will need to be as specific as possible about exactly what was done to her, when, where, by whom, and so forth. Write down her description of what happened, but remember that you are not in a position to judge whether a rape or sexual assault occurred. You are simply repeating what the patient told you. For example, you might say, quote, "Patient states she was raped today at 4 p.m. by an unknown person in Municipal Park," end quote. You should not write, "The patient was raped at 4 p.m." because that implies a legal conclusion on your part. You should also not say the patient was allegedly raped at 4 p.m., because this use of the word allegedly has been interpreted by some people to imply that you didn't believe that a rape occurred. It's better to simply condense and repeat what the patient told you. Gynecologic history. Particularly important are her last menstrual period, use of any contraceptives such as birth control pills, any significant past gynecologic history. Sexual history. You need not obtain a detailed sexual history, but two issues are important to explore with the patient. First, whether she has ever had sexual intercourse prior to the sexual assault, and second, the last time sexual relations occurred within 72 hours prior to the assault. Clothing. If any clothing contains moist or dry stains, remove the clothing, let it dry completely, and place it in a paper bag, not plastic. Use one paper bag for each piece of clothing. Seal each bag and label it. The clothing should be given to the law enforcement authorities and signed out using a chain of custody form. Give the patient a property receipt card for her clothing. The physical exam. Start at the patient's head and work downward, explaining to her what you are doing as you examine her and collect specimens. If you encounter any physical evidence of trauma, you should draw a picture of your findings and, if possible, photograph the evidence. As far as photography goes, take the photographs yourself, without a photographer being present, particularly if the trauma involves areas around the breasts or perineum. Head combings. Lightly comb the patient's hair over a plain white sheet of paper. Fold the paper over the comb and any loose hairs, and place everything in an envelope. Seal and label it. Don't pluck hairs from the head to serve as controls. While obtaining plucked hairs is recommended by some law enforcement agencies, this is a painful and humiliating experience for the patient and almost never makes any difference in the final legal outcome of the case. If the law enforcement jurisdiction in which you are located later requires plucked hairs, they can ask for them at that time. Mouth. Using 2 dry cotton-tipped applicators, gently obtain a specimen from each side of the gums, both right and left, top and bottom. Smear the specimen on a glass slide and let it air dry. Place the dried glass slide in a cardboard slide holder, label it, and seal it. Let the cotton swabs air dry and place them in an envelope, label it, and seal it. Use another dry cotton swab to obtain a specimen for smearing on a chocolate agar plate or specialized collection medium to test for gonorrhea. Label the plate, discard the swab, and send the plate to the laboratory. Ask the patient to place one piece of filter paper in her mouth to become saturated with saliva. She should not chew the filter paper. When it's saturated, ask her to remove it from her mouth with her own fingers and place it in an envelope. Do not touch the filter paper yourself. Let the filter paper air dry, then seal it. Carefully inspect the oral cavity using a tongue blade and flashlight, noting any evidence of trauma. After examining the mouth, offer the patient a toothbrush and toothpaste and mouthwash to rinse her mouth. Particularly if oral contact was involved in the assault, she'll feel much better after cleansing her mouth. This will also give her a psychological break in the exam. Neck, back, breasts, abdomen, and arms. Inspect all of these and palpate them for any evidence of trauma, lacerations, bruises, abrasions, tenderness, etc. Record any significant findings. Examine the hands. Collect fingernail scrapings using wooden toothpicks, one for each hand. The patient may do this herself with you observing. Place the scrapings and the toothpicks in 2 envelopes, one for the right hand, one for the left hand. Label and seal them. Pubic hair combings. Lightly comb the pubic hair over a plain white piece of paper. Fold the comb and any loose hairs into the paper. Place it in an envelope, label it, and seal it. There may not be any loose hairs. Don't pluck hairs from the pubic area to serve as controls. If the law enforcement jurisdiction in which you are located later requires plucked hairs, they can ask for them at that time. Inspect the vulva. Using good light, carefully inspect the vulva for signs of trauma, lacerations, bruises, abrasions, and so forth. Note the status of the hymen. Application of toluidine blue dye, rinsed with vinegar, can highlight recent trauma. The dye is retained by metabolically active cells. Visualize the cervix. After moistening the vaginal speculum with warm water, insert it into the vagina and inspect the vagina and cervix for signs of trauma. Obtain a vaginal swab. Using 2 dry cotton-tipped applicators, swab the vaginal walls and the posterior fornix, the area beneath the cervix. Smear this specimen on a glass slide and allow it to air dry, then place it in a cardboard slide holder. Label and seal the slide holder. Let the cotton swabs air dry and then place them in an envelope. Label and seal the envelope. Do not try to examine the vaginal or cervical specimens for motile sperm unless you are